Hello, this is Dr. Gardner from Nicholls State University, and I am going to be lecturing on the role of the psychiatric mental health nurse practitioner, regulations, and scope of practice. So, why do we review the role of the psychiatric mental health nurse practitioner, the regulations, and the scope? Well, that's the role that you're going to do, correct? Also, the domain of the professional role in policymaking comprises about 30% of the exam content for ANCC. All advanced practice nurses should be familiar with rules and regulations that pertain to their job. So the objectives for this lecture will identify different types of leadership styles. We will explain the therapeutic alliance, describe health promotion, describe quality improvement processes, explain the role of the psychiatric mental health nurse practitioner, demonstrate understanding of advanced practice laws and ethical procedures. So we'll start off with the federal government. We will do a quick review of our government. And why is it important? Because they govern what we do. So the primary role of the federal government concerning healthcare delivery is interpreted under the Commerce Clause of the U.S. Constitution, with an emphasis on regulating interstate trade. There are three branches of federal government described in the Constitution of the U.S., and each branch has a separate but equal powers. There is the executive branch. That is the president, right? The president signs bills passed by the legislative branch into law and deals with national security issues. The legislative branch, that's the House of Representatives. They debate and introduce bills to be signed by the executive branch. They control all federal money. They supervise all agencies of the federal government. They also oversee the Centers for Medicare and Medicaid Services, which is also CMS. CMS is the administrative arm of the federal government that directly influences every aspect of healthcare delivery in the U.S. So you need to understand that. That is why it's important. The CMS determines reimbursement rates based on profession, including the International Classification of Diseases, which is the ICD-10, and the current procedural terminology, which is the CPT codes. And that's covered by which profession. So they determine how it's classed and how it's coded and how we're paid. So accreditation is voluntary. However, you won't get reimbursed if you're not accredited. So it's tied to Medicare, and it's a federal entitlement program. That's Medicare is a federal entitlement program for those over 65 and where the individual or spouse has worked at least 10 years, or they're legally disabled, or they have end-stage renal disease. And there's different parts. So Medicare Part A is hospitals and inpatient stays that are medically necessary. Medicare Part B is outpatient services. So that's clinics, anything that's going on out there. Medicare Part C, those are Advantage plans. And that's private insurance that's managed by Part A and Part B. So it's Medicare Advantage plans. There is Medicare Part D, which is prescription drug benefits. A person must be enrolled in a supplemental plan and only formulary medications are covered. So you can't just have Medicare Part D they will have another part of the Medicare as well. So they have to be in one of those supplemental plans to have Part D. And only medicines on the formulary are covered. And most of the newer medications are not usually covered by Medicare. So you really have to know which medications those patients will be covered for, because if the medication costs too much, that patient is not going to take it. So be very conscious of when you're prescribing for a Medicare patient. Medicaid, same thing. They have a formulary, which they're very strict about. So you have to learn the Medicaid formulary, which is not always the same as the Medicare. So there's Medicaid, there's Medicare. Medicaid formularies are very strict. They follow a tier. So you have to prescribe certain medications before you can get to a different medication. They usually need prior authorizations for their medications, and the ICD-10 code, most often than not, needs to be on the prescription. So Medicaid is a payer of last resort for low income meeting poverty level criteria. It's one of the largest payers of mental health services is Medicaid. And finally, we have CHIP, which is Children's Health Insurance Plan. And CHIP, although it's the Children's Health Insurance Plan, it covers uninsured children and pregnant women. Continuing on, federal restrictions on advanced practice nurses are due to the administrative laws described in the CMS regulations. Only Congress can pass a bill to amend the language of the CMS regulations, pending the signature of the President of the United States. So you have to understand how these laws work, how your reimbursement is, especially because a lot of it is based on the CMS. So one thing you are probably familiar with is the Drug Enforcement Agency, or the DEA. The DEA regulates controlled substances. So if it's a scheduled medication, it is regulated by the DEA, and which is why we will have DEA numbers. So you have to apply after you have a certain amount of hours. You can apply for a DEA license, and that is the only way that you can prescribe controlled substances. In Louisiana, you also need a CDS, which is a controlled dangerous substance license. But providers who are prescribing controlled substances must have a DEA number. And the Federal Bureau of Investigations, or the FBI, they investigate crimes across state lines that have anything to do with the DEA. Next, we have the Food and Drug Administration. The FDA approves and regulates medications and medical devices. So, there's always studies. New medications have to go through the FDA for approval before they are on the market. We have the Centers for Disease Control and Prevention, the CDC, in the Department of Health and Human Services, which is the DHHS, tracks public health trends, aggregates data, and publishes mandates for public health and safety. So this is just a review for you guys. You should all know this. And we have the Health Insurance Portability and Accountability Act of 1996, which is HIPAA. HIPAA is a legislated privacy and security laws to protect personal health information, identifiers from disclosure without a patient's express consent. It guarantees patients 4 fundamental rights: that they have to be aware of HIPAA protection and confidentiality. So that patient should be signing something that there is a protection and confidentiality in place. They must have access to their medical records. There's a CARES Act also now that patients should have immediate access to their records. Now, psychotherapy notes are not a part of the record. However, with most of the electronic health records, all of your note, it's not really separated from psychotherapy and your regular note. So the patient will get that note. They have a right to that note. If it is a psychotherapy note, those are not counted in that because sometimes there's information that can harm the patient that they don't need to read. So those are not a part of the record that has to go to the patient. Anything like prescriptions, when the session starts and ends, any kind of frequency of treatment, their test results, their summaries, their prognosis, any consultation reports, that's all considered a part of the record. And the patient has a right to their record. The patient can also request an amendment to their record if they object to the content. Now, they can request it if it is something that is truthfully documented. That doesn't have to be changed. So a patient is not going to dictate what it is. But if there's something erroneous in that record that they object to, they can request to have that changed or amended. And then there's COBRA. COBRA is the Consolidated Omnibus Budget Reconciliation Act. COBRA covers people who are going to need insurance if they're no longer working at their job. It allows an individual to carry their health insurance from their previous employer for anywhere from 18 to 36 months if they pay for it. And COBRA is very, very expensive. And finally, we have the judicial branch, and the judicial branch is the federal court system. So when we talk about advanced practice laws and governing bodies, we'll talk about individual states because individual states create laws and govern professional practice and they grant licensure. Licensure. The Nurse Practice Act defines the work of nurses and advanced practice. The Nurse Practice Act dictates the state's duty to protect the public from unsafe nursing practice. It delineates practice privileges, licensure process, and explicit restrictions and educational requirements for licensures' basic competencies. Licensure is the process by which an agency of state government grants permission to individuals accountable for the practice of profession to engage in the practice of that profession. So, Louisiana State Board grants licenses to LPNs, RNs, APRNs, so that your license is obtained on a state level. Credentialing, that's the process to verify the minimum levels of professional competence to ensure public safety. So when you are hired on at a practice or a facility, they will do credentialing. And what they're doing is they're verifying that you have the minimum levels of professional competency to ensure public safety. So anywhere you work will credential you. They are obligated to credential you. Certification, that's a credential that allows for title protection. So once you're certified by ANCC, now actually AANP is also offering a certification exam. But you get a credential to work as a psychiatric mental health nurse practitioner once you pass the certification exam. So they're certifying bodies. And so that credential allows for title protection and it determines the scope of practice. It's granted by a professional organization and it certifies that an individual meets the minimum requirements of professional practice. So in order to pass your certification exam, you are being tested on the minimum level. That certification communicates mastery of knowledge and it provides title protection. So, who can be called an NP? So, if you don't have a certification by a certification body, you cannot use that credential. It grants legal authority and establishes mandates for nurse practitioner practice. So, talking about states' exception to confidentiality varies from state to state. So, what is done in Louisiana may not be done in Texas or may not be done in Florida. And it is usually enacted as a result of case law decided by the judicial system. So, if like somebody has an intent to harm themselves, the duty to warn. So, the duty to warn of imminent danger. So, if you are a provider and one of your patients is saying, "Oh, I am so mad. I have been dating this woman. I found out she's cheating on me. I'm going to kill her. I'm going to kill her dead." Sounds like they're from down the bayou. Okay, sorry. I'm from down the bayou, so I hope nobody's offended by that joke. Anyway, there is something called the Tarasoff Principle of 1976, and that is a duty to warn of potential victims of imminent danger. So this patient is in here telling you he is going to go and kill her. If you have to warn her. You have to warn her, and of course, you let the authorities know he is out to kill her. If you don't, if you think that protecting this patient's confidentiality supersedes warning that victim, it does not. Also, we report child and elder abuse as well. We have a duty to report any child abuse, any elder abuse. It may be difficult. You feel like you're betraying somebody, but your duty is to report any abuse. Okay, we're going to go over some terms. The first is informed consent. Informed consent is respecting the patient's right to autonomy, and that's a communication between the provider and the patient, and that clearly explains the risks and benefits of particular treatment, the condition they're being treated for, the risks and benefits of refusing that proposed treatment, and any alternatives to the proposed treatment. So you have to gather an informed consent. The patient has to know what they're signing up for. And no assurances should be made for a particular outcome of any treatment. Informed consent can be obtained from emancipated minors. Next, we have capacity. Capacity is a clinical decision based on a psych eval to determine the patient's ability or power to do, experience, or understand something. So you may actually have to do a complete physical with labs to determine that. So what some questions you may ask is, what's your understanding of the condition and what are the options for your situation? What is your understanding of the benefits or treatment and odds of success? So that's how you can determine if they understand. What is your understanding of what will happen if nothing is done? So you understand their capacity. Competency, that is a legal designation regarding a person's ability to make reasonable decisions regarding their own well-being. All persons of legal age are presumed to be competent unless a court declares the individual incompetent. So we'll talk about involuntary commitment criteria. That varies from state to state. So depends on what state you're going to work in as to what that criteria is. But If a patient has to be involuntarily committed because they are a danger to themselves or someone else, they still retain all of their civil liberties except for the ability to come and go as they please. They don't have that. And some of the general criteria include the person must have a diagnosed psychiatric disorder. They must possess harm to themselves or someone else. They're unaware or unwilling to accept the nature and severity of the disorder. So it could possibly be a schizophrenic patient, unmedicated, that cannot take care of themselves or understand the severity of that disorder. Then they may need to be involuntarily committed to get them stable. Also, treatment is likely to improve their functioning. So again, that schizophrenic patient who is having a crisis may need to be committed to get them stabilized. So there's different professional organizations. There's the American Nurses Association, American Academy of Nurse Practitioners. There's the American Psychiatric Nurses Association. So there's so many more. This is just a few of them, but professional organizations are important. If you don't already belong to one, consider joining. And as a student, usually you can join for very, very deep discounts. So we'll talk about scope of practice. And scope of practice says who may do what, when, where, and how. It's governed by the terms of the state's professional license or the Nurse Practice Act. The scope of practice is limited to each state's Nurse Practice Act. So in Louisiana, we follow Louisiana's Nurse Practice Act. It says what nurses are able to provide what nursing care and under what circumstances. Standards of practice, it's an official reference explicitly stating the rights and privileges regarding the type of practice. It defines the NP roles and actions, and it identifies competencies assumed among members of the profession. It also it reflects expectations of care and can be used to legally describe work of the profession. And there are certain standards of care that I will post a link that you can go and look at the different standards of care for mental health. There is also a book, however, you have to purchase that book. I will post a link to the book in the course, but you do not have to purchase it. It is good to have, especially when you are learning and don't know. So it is a good resource to have, but you are not obligated to buy it. Okay, so let's talk about the role of the nurse practitioner. So one of the core competencies is managing and negotiating healthcare delivery systems. So you negotiate legislative changes, consider financial implications related to healthcare delivery, utilize business principles to promote justice, and be an advocate. We have to have our voices heard, but if we're not out there involved at the Capitol trying to get changes will not happen. So there are so many other states with full practice authority. Louisiana is not one of those states. We still have a collaborative practice agreement. So you cannot work independent of a physician. You can have a practice, but you need a collaborative practice agreement to do that. Whereas if you worked in Washington, you do not. If you work in Oregon, you do not. There's several states that you can work on your own with full practice authority. That's because legislation changes things in different states. So if you're involved, get your voice heard. go to the Capitol, go to when the nurse practitioners are at the Capitol. Let those speakers hear your concerns. We monitor quality indicators, so we incorporate evidence-based practice principles into our daily practice. That is how we practice evidence-based medicine, cut and dry. We provide cultural sensitive care. So we increase personal cultural sensitivity and awareness when assessing patients' perceptions of illness and health. And we consider the cultural interpretations of the various roles in healthcare delivery. And a part of our professional role is advocacy. We have to stand up for our patients' rights and empower them to self-advocacy. So we empower our patients to advocate for themselves. We are empowered to reduce the stigma associated with mental illness, help patients receive available resources, participate in professional organizations, and we work collaboratively across and within organizations. Some of the different places that psychiatric mental health nurses can work is private practice, hospitals, schools, universities, jails, ACT teams. There's so many different places that we can work, but our core competencies remain the same. Okay, next we will talk about different types of leadership styles. And why do we talk about leadership styles? Because nurses should be leaders and engage with health professions to transform and redesign healthcare. That is also one of your roles. So, what type of leader are you? Are you a transformational leader? Transformational leadership is marked by a charismatic ability to communicate vision and secure buy-in from stakeholders. Situational leadership, that's a style marked by flexibility and adaptability to the context of the situation and an ability to engage at various levels with key stakeholders and address their concerns. Then there's the authoritarian leadership, and that style is motivated by independent, self-directed individuals who prefer to give specific directions and exert control over a situation with little to no input from anybody else in charge. So what you say goes. I don't want to hear anything else. This is how it's going to be, and that's it. That is an authoritarian leadership. A democratic leadership is emphasizing the team process and it's valuing input from stakeholders, and decisions are made by a consensus. So it's more of you're listening to what everyone has to say and then a decision is made. It's not just the decision of one person. There is a laissez-faire leadership, and that's marked by indecision and ambiguity. So it's suited to figurehead individuals who have very experienced, autonomous, and self-directed subordinates. So pretty much they trust those underneath them to make all the decisions. They just kind of sit at the top and let it happen. And then there's the servient leadership. That's a style marked by the follow me rather than a forward march. In that approach, the leader works alongside the subordinates, adopting to fill in the gaps, and they may inadvertently enable poor performers when they do that. Nurse practitioners are educated to lead interdisciplinary teams as full partners in the care. Nurse practitioners design, implement, evaluate, and advocate to redesign healthcare systems and engage in evidence-based clinical practice. Okay, we're back to the core competencies. health promotion and disease maintenance, disease prevention education, therapeutic interventions, comprehensive physical assessment and psychiatric evaluation. And that entails the mental status exam, diagnostic tests, distinguishing various variations of normal from abnormal, the physical exam by the psychiatric mental health nurse practitioner with neurological emphasis, the family system evaluation, and prevention screenings guided by clinical guidelines. So these are some of the core competencies of the psychiatric mental health nurse practitioner. So when we talk about the comprehensive physical assessment and psych eval, psych nurse practitioners should rule out underlying medical conditions and screen for non-psychiatric disorders. You're going to evaluate physiologic reserve and functional ability, compile differential diagnoses, and identify a primary psychiatric disorder. So you will always identify the differentials and have a primary psychiatric disorder. You will utilize the DSM-5 TR and ICD-10 codes for the treatment and planning and coordination of care. So that DSM-5 TR, get used to it. You will use it in this course, you will use it in your next course, you will use it in the course after that, and you will continue to use that after you graduate. So, mental health promotion education, that is, we are teaching coping strategies. You are distinguishing a barrier of no mental illness with a normal variation, helping identify feelings and behaviors. And you help patients identify community resources for mental health. We provide psychoeducation, psychopharmacology education of patients. We monitor for adverse effects of our psychopharmacology. We also provide oversight in authorizing services and benefits. We also want to promote cost-effective quality outcomes and be involved in patient-centered medical homes when needed. Okay, let's move on to ethics. So we talk about ethical principles, which is governing decision making. Ethical principles govern decision making. So there's different types of governing, which there is autonomy, and that's the right to self-govern, free from any external control or influence. Of course, the patient must be involved, and they do have the right to refuse treatment unless they're incompetent. And they also have the right to be treated with the least restrictive manner and in the least restrictive setting. Beneficence is doing good and promoting well-being. Non-malfeasance is doing no harm. Veracity is conformity to facts, truthfulness, and accuracy. Justice is the quality of being equitable and reasonable. And of course, respect is regard for the feelings and wishes. Okay, and the rights and traditions of others. So, respect is the regard for the feelings, wishes, rights, and traditions of others. So, in there's some ethical decision-making dilemmas. A dilemma is a situation in which two or more justifiable alternatives have both similar risk and benefit. That causes a dilemma. A deontological theory is the action judged as good or bad on its merits, regardless of its consequences. Patients have the right to know what's happening during their treatment. So remember, patients have the right to know what's happening during their treatment. You do not hold that from them. And the teleological theory is the goodness and badness of an action is based on the foreseeable consequences. So, as a result of disclosure, the patient may have legal recourse for financial restitution. Individuals may suffer harassment or discrimination. They may request reasonable accommodations, opportunity for personal support from peers. And then there's virtue ethics. Virtue ethics is the actions are based on moral or ethical principles. Providers have an ethical duty to disclose errors, accidents, injuries, and positive test results to their patients. So if you make an error, you have a duty to disclose that error. So that is virtue ethics. So we've already discussed dilemma. We discussed the deontological theory, and we discussed the teleological theory. Cultural competence dictates people should be treated as unique individuals by considering their social context when providing care. And we want to have cultural awareness. That dictates using the knowledge of the individual's cultural experience to inform the clinician's interpretation of the signs, symptoms, and perceptions while applying the ethical principle of respect. So, what is culture? Culture is the beliefs, values, behaviors, and characteristics among members of any group. Ethnicity is a self-identified descriptor of like a race, a tribe, a nation, or a community. Culture-bound syndromes is transient, non-pathological behaviors associated with culture. It's essential for clinicians to be mindful of this phenomenon to avoid inaccurately labeling this as a psychiatric disorder. So if a patient says, I need to consult with my great grandma before we do anything. I can't agree to this treatment plan unless I consult with my great grandma. And you say, okay, after you talk to your great grandma, come back, or do we need to call great grandma? And she's like, oh no, she's dead. That does not mean that you cannot equate that to a psychiatric illness of your patient. That is a cultural norm for that patient. Environmental determinants of health is the safety of the immediate surroundings, their climate, their air, their water quality, stability of financial resources, socialization, crime exposure, transportation, climate control. And then we have cultural health determinants. So families pass along norms, beliefs, and values related to essential functions of daily living, like food, shelter, safety, belonging, and education. And we have to consider special populations. So that would be like the homeless population, sexual minorities, victims of domestic violence who are fleeing their home to live somewhere else. So there's so many different considerations when we're treating patients, and all of this encompass the cultural competence that we must display. So we'll end with health promotion. Health promotion involves having familiarity with the leading causes of death. So you as a provider should know what the leading causes of death are at the present time, immunization schedules, preventive strategies, routine screenings based on age and stages. Like this is something that you will do even as a psychiatric mental health nurse practitioner. And this allows you to provide anticipatory guidance to your patients. So this should be a review for everybody. When we talk about specificity, that is the degree of confidence in a test for a particular condition or trait. That looks for a true negative, and that's to rule something out, right? And it's a very specific test to rule out a disease with a high degree of confidence. So specificity is to rule out, whereas sensitivity is looking for the true positive, and that's going to rule in a disease. So a degree of confidence in a test to detect the presence of a true positive is sensitivity. Primary, secondary, and tertiary prevention. We'll just review that briefly. This is a review. Primary is healthy people are provided the advice like balanced diet, wear your seatbelt, exercising, using helmets, maybe workplace safety measures, talking about not drinking and driving, some general measures for mental health like having hobbies, friendships, support systems, a purpose. That's all primary. And prevention is used to reduce morbidity and mortality, right? Due to different disease conditions. Secondary prevention is looking for disease in a group that's at risk. So sensitivity, right? By checking their blood pressures, doing mental health screenings like the PHQ-9 or the mental status exam, screening for sexually transmitted infections, using long-acting injectables to prevent recurrence of psychosis. Patients taking medications like methadone or naltrexone, that's all secondary prevention. And tertiary prevention, that's reducing disease progression in someone who is diagnosed, often after an acute treatment and stabilization. So like drug rehab, alcohol rehab, therapy, psychoeducation, support groups, that's all tertiary. Okay, we will end this with anticipatory guidance. Anticipatory guidance is a tailored prevention framework to reduce morbidity and mortality. It assumes information provided in a timely manner will reduce morbidity and mortality along with the lifespan. And all of this has to be done in the need for information is determined in a systematic manner because you need to know what is important for your patient. So providing information in a timely manner should reduce morbidity and mortality. Sites like Bright Futures, that's web-based guidelines for anticipatory guidance for children. And that's because every child deserves a healthy and optimal relationship with a healthcare provider. So anticipatory guidance, we're going over this because it is part of your psychiatric eval for this course. Anticipatory guidance, I do believe, is worth about 20 points. And remember, 20 points is not 3 sentences. Eliciting information, that's getting information from key individuals regarding the unique needs of the patient based on age, disease, developmental milestones, medication adherence. So you could do like car seat safety, water safety, stranger danger, red flags. And then there's health specific guidance, which is assisting individuals to meet the healthcare challenges across the lifespan, like the anticipated decline in death and grieving, anticipated disease progression, such as like Alzheimer's disease or psychotic disorders, exploring the risk of domestic violence, survivor coping after divorce or death. So those are all specific. So when you're doing your anticipatory guidance, it should be specific to your patient. Okay, and that is it for this lecture. Please let me know if you have any questions.